Hello, my dear students. I am Ibrahim Hamad Saleh, Lecturer Assistant, Faculty of Nursing, MTI University and Wadi Nursing Institution. Today, inshallah, we will demonstrate one of the most important procedures at medical surgical nursing. It's how to measure blood pressure. Let's start with the equipment. The equipment that you will need it: sphygmomanometer, clean gloves, alcohol swab, kidney basin, and stethoscope. So, what is blood pressure? Blood pressure is one from the vital signs. Vital signs are pulse, respiration, temperature, blood pressure, and pain score assessments. One of them, and maybe the most important of them, how to measure blood pressure. So, the normal range of blood pressure is 120/80 plus the 120 called systolic and the 80 called diastolic. We can add 20 to the systolic or minus. This is the normal range. And we can add 15 or minus them to the diastolic. Let's start with the procedure. All of us know that there are fixed steps before starting or doing any nursing procedure. Number one, check the physician order or the hospital policy to make the procedure. Number two, wash your hands and prepare the equipment. Number three, introduce yourself for the patient. How are you? I am Ibrahim Saleh. Next, identify the patient correctly by at least two ways. Asking the patient about his name. What's your name, please?
I'm Aman Muhammad.
And seeing the patient ID band. Put the patient in comfortable position and also should be suitable position for the procedure. Maintain the privacy to make the patient calm during the procedure. Don't forget, the equipment should be near of you. Wearing clean gloves. Before using the equipment, you should check the efficiency of it. So, yeah, it's working. Also the sphygmomanometer. Check if it's working or not. Yeah, it's working. Sir, I will measure the blood pressure to you. You can ask the patient some relevant question, like, are you smoked before?
No, I'm not smoking.
Are you?
I'm not a smoker.
You aren't a smoker? Good.
But I don't feel so good today. I have a headache.
Yeah. The history you should take from the patient to be aware during measuring. And don't forget to check the last vital signs that the patient that recorded in patient file. Measuring vital blood pressure can be divided to two phases. Number one, called palpatory phase, and the second called auscultatory. Number one called palpatory, and second phase called auscultatory. So, in the palpatory phase, the nurse should feel the radial pulse. All of us know where is the radial pulse site? Yes. Here. Check the radial pulse. Yes, I feel it now. Then check the brachial pulse. Yes, I feel it. Then broad the cuff and roll it around the patient arm. Don't forget to sleeve the clothes as you can to hear clearly during this procedure. Roll the cuff gently, but it should be tight. Shouldn't be loose. Expose the pulse site. This tubes should be over the pulse site. Now, this is called a valve. Okay. It is working. With one of your hands, check the radial pulse. Put the patient hand in comfortable position. Close the valve and start to inflate the cuff. Now, I already feel the pulse. I will start to inflate like this. The mercury line is increasing now. I can't feel now. So I will stop and see the number, then deflate. The number was 100 over 30, 130, not over. So we can add 30 to this number in the auscultatory phase. Be sure that the cuff is completely deflated. Now the first phase finished. The second phase, clean the earpiece with alcohol swab. You should clean it before using and after. Before using the equipment and after it. Check it secondly. Put it in the brachial site. Close the valve and start to inflate the cuff second time. Don't forget to add 30 over the number that the pulse disappear on it. To reach it to 160 now. So I will try to open the valve slowly and gently and try to hear the first beat sound. Yes, here 120. This is the first beat. It's called systolic pressure. Systolic pressure. Then you will continue to deflate Open the valve slowly. Now, I can't hear. The last beat was on 70. Complete the cuff deflation. Remove the stethoscope. Remove the cuff. Thank you, sir. Now, you should clean your equipment, as we say, circular motion, one direction, without return. Close the cuff, open the clamp. Now, reassure the patient. Your blood pressure is in normal range. Okay? You want something from me?
Thank you.
Thank you. Remove your gloves. Discard it. Wash your hands. Then it's time of documentation. Don't forget, not written, not done. So you should record the blood pressure measuring, and if you found any problem during measuring, please inform the physician. Thanks.